Hi, you guys. Welcome back for our daily practice questions. It is day 50, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, we have been working on cardiology for the past few weeks of this month, but now we're rolling into our anemia section. Check the video. But for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to get into my disclaimer and reminder that we know there's no absolutes in medicine, right? We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. Question number 1 states, a 40-year-old female presents with fatigue, pallor, and lightheadedness. On physical exam, she is noted to have pale conjunctiva and mild tachycardia. Her hemoglobin is 9.2, MCV is 72, and MCHC is 29. The rest of her CBC shows a low red blood cell count and low ferritin levels. Based on the following lab findings, which of the following is the most likely diagnosis for this patient? Is it A, iron deficiency anemia, B, vitamin B12 deficiency anemia, C, thalassemia, or D, anemia of chronic disease? Take a moment and tell me what you got in the comments, you guys. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, based on the lab findings, which of the following is the most likely diagnosis for this patient? Y'all know my rule. If they're asking for a diagnosis, you need to run it back and look at those assessment findings. When I say assessment findings, I'm telling you to look at the signs and symptoms. How does this patient present? What is noted on exam? And then I tell you to pay attention to 3 factors if provided, right? Their age, their gender, and their ethnicity, as this can help to contribute to determining a diagnosis or treatment in some situations, right? So here we have this 40-year-old female who came in with fatigue. She's pale, lightheaded, and on physical exam it's noted that she has pale conjunctiva, mild tachycardia. Lab values are abnormal as well. Hemoglobin is 9.2, so we know we're thinking some form of anemia, right? Her MCV is 72, so that's microcytic, because the normal ranges for MCV is anywhere from 80 to 100. So 72 will be less than that 80 range, so that makes that microcytic. And then the MCHC is 29. So the normal range for that is 31 to 37, so that makes this hypochromic. Now the rest of her CBC shows that she has low red blood cells and a low ferritin level, right? So break down these things. We know she has anemia. She's presenting as someone who has anemia. Now we're determining what type of anemia, right? Now, microcytic hypochromic, I always say my 2-1-2 rule. If you struggle with anemia, go check my anemia video out. But 2 things fall under the microcytic hypochromic range, which is your iron deficiency anemia and your thalassemia. So we know here our answer should be either A or C. Now, this particular patient has a low ferritin level as well, which is your iron stores. Ferritin is your iron stores, right? So with iron deficiency anemia, I always tell y'all, if things present similarly, you have to know how to differentiate, right? So if iron deficiency anemia and thalassemia both show up on a lab's value spectrum as microcytic and hypochromic, then how do you determine one versus the other? Well, with iron deficiency anemia, your iron is low and your ferritin is low, right? Because if you're deficient in iron, you don't have iron stored up, right? So ferritin is your iron stores. You cannot have iron stored up if you are deficient in it, right? If your bank account is deficient, you don't have money saved up, right? So your iron stores are low. Whereas with thalassemia, your iron and your ferritin levels will be normal, okay? So here, the best answer is A, iron deficiency anemia. Question number 2. A 32-year-old woman presents with complaints of fatigue, brittle nails, and pica. Her CBC shows a hemoglobin of 10.5, a MCV of 70, an MCHC of 28, and a low serum ferritin level. She has no history of chronic disease or significant blood loss. What is the most appropriate next step in the management of this patient's condition? Is it A, prescribe oral iron supplementation and advise dietary changes? B, initiate vitamin B12 supplements? C, a blood transfusion? Or D, start erythropoietin therapy? What y'all think? Tell me in the comments. All right, so stem of the question here, what is the most appropriate next step in the management of this patient's condition? So long story short, what is the treatment, right? So we got to know what it is to be able to treat. Y'all know I always say if they're asking you for a treatment, run it back and look and see if they have provided you with a diagnosis. In the event that the diagnosis has not been provided, you got to take it a step further and look at those assessment findings so that you're able to determine the diagnosis, because you got to know what it is to be able to treat it, right? So we're going to start from the top. We have a 32-year-old female. She comes in. She's complaining of fatigue. She has brittle nails, pica. All right. Already presentation alone should start to have differentials in your head. You're thinking anemia. When we say pica, you're starting to think iron deficiency anemia, right? And if you didn't, start putting that into your file cabinet of things to remember in your brain, that pica is associated with iron deficiency anemia, right? Think about the people craving ice chips, pica. All right, so her CBC shows hemoglobin of 10.5, further confirming our theory of anemia, right? MCV is 70, so that is what? Low, right? Because we just talked about it in question number 1, it's less than 80. Our MCV should be anywhere from 80 to 100. So sitting at 70, she's microcytic. MCHC is also low, so hypochromic, because again, it should be 31 to 37. And then a low serum ferritin level. We just talked about this. Again, this is somebody with iron deficiency anemia, right? Because we have microcytic hypochromic and the ferritin levels are low. Her presentation is classic for iron deficiency anemia with the brittle nails. They also may show up as spoon-shaped nails, and also with the pica. Classic presentation for iron deficiency anemia. And then, sidebar, those classic presentations, remember I tell you to know those key identifiers, because they want to know that you know the common things on boards. So, I always say, like, when I say this, you say that. So when I say pica, you say iron deficiency anemia. When I say brittle spoon-shaped nails, you say iron deficiency anemia, right? So here we're saying iron deficiency anemia is the diagnosis. So how do we treat this? So your best answer is going to be is going to be A, prescribe an oral iron supplement and advise dietary changes. We know we're not doing B because we don't need to give B12. There's no B12 deficiency noted here. We don't need to do a blood transfusion. And starting erythropoietin, that is a option for treatment for thalassemia, okay? So that's why it's important to be able to identify iron deficiency versus thalassemia, because you can see and know that MCV and MCHC are low, right? And so you get stuck on those two. But if you don't know how to differentiate one versus the other, then you would have been stuck on treatment options, right? So make sure that you walk yourself through all of the steps. That's why I always tell y'all, assessment, diagnosis, evaluation, and treatment. If you walk through that way on all of the things, all of the diagnoses, you're going to be able to pivot however the question is delivered to you. It's when we stop in those little pieces and just know the generalized thing like, hey, pica, hey, MCV, MCHC, and then you don't know anything else, then you get those questions, and that is what is stopping you and stumping you on the exam. That's that gap I talk about when I do question analysis sessions with you guys, because identifying the gap is huge, because you're missing those little tiny pieces, and that is what is affecting you taking your knowledge and applying it correctly to pass boards. But anyway, the answer is A, y'all. All right, and lastly, question number 3. A 65-year-old male presents with fatigue, glossitis, and difficulty with balance. His lab results show a hemoglobin of 10, a MCV of 110, and an MCHC of 34. What is the most likely cause of this patient's anemia? Is it A, iron deficiency anemia? Is it B, thalassemia? Is it C, vitamin B12 deficiency, or is it D, anemia of chronic disease? Take a moment and tell me what you got in the comments, y'all. So stem of the question here, what is the most likely cause of this patient's anemia? All right, so we have a 65-year-old male, presents with fatigue, glossitis, and difficulty with balance. So we already know that we're thinking anemia, but that presentation, again, is key identifiers. So what would you be thinking? You should start to already have in your mind vitamin B12 deficiency. With B12 deficiency anemia, glossitis, that beefy red tongue, all of those things are classic. Classic. Difficulty with balance, they have neural deficits, So key identifiers. But let's proceed to see if the labs match with what we would anticipate for B12 deficiency anemia, right? So the hemoglobin is low as expected. The MCV is elevated, so macrocytic, right? Because what is our normal range? It's 80 to 100. So it's exceeding 100, so we're at macrocytic. And then the MCHC is normal, so normal chromic, because the normal range is 31 to 37. Remember, again, 2-1-2 rule. There's 2 in the lower scale out of the 5 common anemias. That's your iron deficiency anemia and your thalassemia. There's 1 that falls in the normal range, which is your anemia of chronic disease. And there are 2 that fall in that higher range, which is your macrocytic normal chromic. And those are your B12 and folate deficiency anemia, right? But here, your best answer is C, vitamin B12 deficiency anemia. Vitamin B12 deficiency is what is the cause of this anemia. But again, if you struggle with anemias and need assistance with how to retain and decipher these labs and the breakthrough, go check out my anemia video. If you go to my playlist, I have it under that anemia section, and you can hear my 2-1-2 rule that I was briefly talking about, so you can understand what I'm saying. But all right, you guys, as always, I hope you found this helpful. But be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or custom packages or plans, as always, I say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.